All right, looks like we are at a steady number, so we'll go ahead and get started. Welcome, everyone, and thank you for joining our informational session today on the AACOM ClinED Accelerator. I'm Melinda Long, and I'm joined by Dr. Robert Cain, AACOM's President and CEO. We scheduled this session as we heard from many of you that the ClinED Accelerator sounds interesting, but that you would like more clarity. There are questions about what a hackathon is, how much time this will take, if you need to be technical to participate, and if you need a fully formed idea to participate. These are all great questions. We want to be as clear as possible with you today in this information session. We are recording this session and we will share it with you afterward. Every question that you ask today will help us to improve the event, and it will also inform our frequently asked questions that will be available to everyone that's participating in this effort. So please, throughout this session, as questions come to you, put them in the chat or the Q&A feature. My colleague Hannah Burgess will be monitoring those and answering those as we are able to today. We do want to thank our presenting sponsor for the ClinED Accelerator, the American Academy of Family Physicians, AAFP. So a quick roadmap so you know where we're going today. Dr. Cain will open with why AACOM is investing in this effort. Then I will walk through what the accelerator actually is. I'll go through each track or challenge track, so hopefully the challenges seem more manageable. And then we'll finish with practical steps to register and get started. Hackathons are common in technology, but rather rare in medical education. So when people say hackathon, a lot of people picture something that we're actually not running. So we'll take some time to share with you exactly what will happen over the 6-week period, starting September 1st, what you will be asked to produce, and what it costs you in terms of time and also money, which is none. We want to leave time for a lot of questions. So even if we don't answer all the questions or don't have all the answers today, we promise that we will respond in a few weeks or in a week or so and make sure that we are able to address all the feedback that you're giving us today. With that, I'm going to turn it over to Dr. Cain for the framing.
All right, well, thank you, Alenta, and welcome to everyone who's joining us for this webinar. Medical education has an extraordinary foundation, but it's important to remember that it was built for a particular time and, in many ways, a particular place. The reforms associated with Flexner helped establish scientific rigor and consistency in medical education. But they also helped establish the university and the academic medical center as the dominant standard against which medical education came to be judged. Osteopathic medical education has spent decades demonstrating something different. High-quality physician education does not require the university academic medical center to be its center of gravity. We have educated physicians in community hospitals, ambulatory practices, rural communities, and distributed clinical environments across the country. But there's an irony in that success. Even as we moved medical education into the community, we largely brought the academic medical center's educational architecture with us. Think about it. Rotations, clerkships, core experiences, blocks of time, discipline-based requirements. We changed where medical education could occur without fundamentally reconsidering how it should occur. And I think that is the opportunity before us now. Next slide. Because while that educational architecture has remained remarkably familiar, almost everything around it has changed. Care is increasingly team-based, technology-enabled, and distributed across many settings. At the same time, clinical sites and preceptors are stretched, and our learners need more meaningful roles in care. Those pressures are exactly what this slide is describing. So the question may not simply be, how do we find more rotations? Maybe we need to ask a more fundamental question. If the community is not merely an alternative site for clinical education, but a fundamentally different learning environment, what kind of educational model would we design for it? What if we started with the community rather than the clerkship? What if we started with the needs of patients, practices, and health systems rather than a predetermined number of weeks in a particular discipline? What if students could become meaningful contributors to care earlier in their experience? What if continuity with patients, teams, and communities mattered as much as moving from one rotation to another? And what if technology, simulation, AI, and new forms of assessment allowed us to rethink what must happen in a traditional clinical setting at all? Those are the kind of questions I think we now have permission to ask. Next slide. And that's why I think of this accelerator at its core as a form of crowdsourcing. We are not assuming that AACOM has the answer. We're not assuming that a small committee or a small group of experts has the answer. We are turning to the people closest to the work because they see things the system itself may not see. The student knows where learning becomes observation. The preceptor knows what makes taking another student difficult. The clerkship director knows where the current model creates unnecessary friction. The community physician sees opportunities for students to contribute that our traditional curriculum may not recognize. And somewhere, someone has probably already tried something different that the rest of us have never heard about. That's why the invitation on this slide is so important. Bring your experience. Bring the problem that has bothered you for years. Bring the unanswered question. Bring the idea that is not quite formed yet. That is exactly how the accelerator is designed to work. We're not asking you to arrive with a polished solution. We're asking you to help us question some of the assumptions behind the system we inherited. Because perhaps the opportunity here is not simply to make the existing model of clinical education work better. Perhaps it's to imagine the model we would build if we were starting today. And if we're going to do that, the people closest to the work should help design it. Back to you, Alenta.
Thank you so much, Dr. Cain, for that framing and for inspiring us all in your remarks. So I'll start with this slide, hackathon. And this is probably the most important slide that I would like you to walk away with. We use the name hackathon, and our tagline is hacking the future of osteopathic clinical education. But the word carries the connotation from the tech industry. And in medical education, people may read hackathon and think this is not for me. So we want to be direct about the left side of the slide or the column. None of it applies here. So no overnight coding, no app requirement, not a weekend that you spend locked in a room trying to figure out a solution. What we borrowed from the hackathon model is a defined window, a real problem, a diverse team, mentors, and a deadline that forces you to get concrete. We believe that that combination will produce really innovative ideas. The word we chose deliberately is accelerator because the emphasis is on outcomes, practical enough to actually probably pilot. I want to just read the definition of hackathon here so everyone has the same understanding. Hackathon is a time-bound event where people from different backgrounds form a team, take on a defined problem, and present a proposed solution by a given deadline. So the deadline and a mix of people are truly the method. Coding and anything technical is a potential output, but it's not the point. So really want to clarify that when we mean hackathon, this is what we mean. The ClinED Accelerator is for a broad audience, as you see listed here. We would like to produce innovative, practical solutions in whatever form that fits. It can be an app, it could be a pathway, it could be a document that you produce, a potential solution that you produce in different formats. It takes 6 weeks to work on this project, and we're very flexible. We want to work around your schedule. We want you to bring your own teams if you want to work with a team, or we will help you build a team, or you can even work on it on your own. You also don't need a product that you ship at the end or that's finished at the end. You need an idea, something that you're passionate about, that can really show value and address the challenges that we're describing. We also want to note that AACOM is partnering with Be My App. They're a national firm that organizes hackathons professionally, and so they will be executing this innovation challenge for us. So a few takeaways in terms of what we really want you to take away with today. We really want you to register. That's the first step. Registration is free. Everyone must register individually to participate in this innovation challenge. Even if you have a team, that's fine. You still need to register individually. Eventually, we want you to work through and think about who you want to be part of your team if you want to participate in the team. But we can also match you, working with Be My App, we can match you to a team once you register. So registration is the first step. That's where you'll start to find out information. That's where you'll get ready for our kickoff webinar on August 31st. And all other content will be available to you once you register. So that's the big key that we want you to take away from. Starting September 1st, that's when the platform opens. That's when you'll be able to choose your challenge track, which we'll talk about in a little bit. You'll be able to focus on a solution. You'll be able to flesh your solution out with a team or again by yourself and work through submitting your project. Just want to reiterate, this is fully virtual, September 1st through October 13th. You have that window. We also want to flag for you that you might receive emails, or you may already be receiving emails from our partner, Be My App, BeMyApp@acom.org. So please ensure that that's whitelisted so that you are getting all the information that you're interested in for this hackathon. I also wanted to cover a few questions that we've been hearing over and over again so that you are very clear about these questions. The cost to participate is free, as I mentioned. There's no registration fee, no platform fee, nothing for you to participate. Coding is not required, and neither is hackathon experience. And projects can take on various forms. So you could have a curricula, you could have workflows, you could have partnership models or assessments or a business plan, a toolkit, many different forms. Some may actually involve software, so you might be interested in exploring that pathway, and that is welcome, but it's not the expectation. A finished idea is also not required, so you do not need a finished idea. The project page, which I'll talk about in a little bit, literally will ask you what stage you're at in your sort of exploration, and you can select concept only. So you could just have a concept and use the 6 weeks to flesh out that concept. That is a legitimate answer. We also get quite a few questions about time. So how much time to dedicate to this? The official guidance from our facilitator, Be My App, is over the 6-week period, 1 to 2 hours per week would be appropriate. For towards the end, perhaps 3 to 4, particularly if you're working with a team and you're wanting to meet with your team right before you submit. You might want to meet more frequently, but that's a general recommendation if you're considering participating. You could also submit everything in one day. If you already have an idea, you want to take time to flesh it out and submit everything September 1st when it opens, you are able to do that as well. So we want to be flexible. We want to allow you to work on your time, your team's time, and what works best for everyone. The other question that we get frequently is if you need a team to participate. You do not need a team to participate. You can register. You can arrive with one. You can work within your COM or your institution to select individuals you want to work with and register, or you can ask to be matched. So during the registration process, you can actually ask to be matched with others, and you can also choose to work alone. So all 3 of these choices are supported. So hopefully that clears up a few questions before we get into some of the details. So I'll talk a little bit about the tracks. This actually seems to be the area that folks are most interested in. So this is exciting. It just shows how passionate this community is. Before I go through them, just want to clarify a few things. First, a track is just a focusing device or mechanism that we're using because we have big challenges that we're facing. It is not a separate event with separate rules. Whichever track you choose, you get the same platform, you'll get mentors, you'll get the same session. So this is the same experience regardless of challenge track. So we want to clear that up. Second, the track descriptions that you saw on the AACOM website and that we'll be posting, I'm sure Hannah will be posting shortly, are deliberately ambitious because they describe the whole problem space. But you're not being asked to solve the entire problem. You're being asked to take on a piece of it and make that piece work. So I'll spend a few minutes going through each of the tracks, but I want to also share, just step back a little bit and share with you how these tracks came about. So last year, AACOM convened a think tank in October through the AACOM UME JME Task Force. We put together medical educators, DOs, and MDs and spent 2 days mapping out what most needs to change in clinical education. And their conclusion was that incremental change will not fix the underlying model. So if one of the tracks really sounded as though it was sounding your daily frustration, it's likely because it came from someone in your role. We've been working on this and really convening clinical educators and others for about 3 years, trying to innovate in the space. So this think tank that I mentioned envisioned a future model for clinical education. And that's what we integrated into these 5 tracks. And I'm sure we'll drop in the report from the clinical education think tank so you can look at the full picture of what they were envisioning. What we're hoping through this hackathon is that we use this challenge to bring some of this vision to life. So we're going to go through each track. So track 1 starts from a frustration that many of you will recognize. Clinical sites are stretched. Students are often too positioned as adding more work rather than adding capacity. The question is whether this has to be true. So a question to ask here is, have you ever thought a student could contribute more to the clinical setting than they currently do? Could a student appropriately be supervised and be doing patient navigation, population health outreach, quality improvement work, other documentation support, or other things? So this track is about designing appropriate supervised roles that lets students support patients, care teams, and clinical sites while they learn. These are examples here on the screen of potential submissions. We don't want to pigeonhole you. We don't want you to think these are the only pathways or different products that you can consider, but these are just examples of what a submission could look like. It doesn't need to be a national model. It could be a local model that works. It could be a role description, a supervision protocol, a training requirement, or maybe a case of one institution, one medical school, and one clinical partner coming up with a plan for a certain type of student in a single semester. So lots of options here of what's possible. So I'll move on to track 2. Track 2 is from rotation sites to strategic partners and is sponsored by the American Osteopathic Association, the AOA. The most common clinical site relationships are often seen as transactional. We place students, the sites will host the students. There's obviously agreements that are occurring. Clinical sites obviously want to reduce administrative burden. They have workforce development goals, and they would like better patient care. Medical schools also want the same thing. COMs need sustainable training capacity. And they want partners that reinforce osteopathic identity and osteopathic training. So the question here could be, could we design a model that delivers both? What if a clinical site were more than a place where a school sends a student for a clinical rotation? So this track is about building partnerships where colleges and clinical organizations solve shared problems and create value on both sides. So some ideas here worth exploring. Perhaps a common health system partnership blueprint could be an idea to explore. Or maybe a shared faculty or workforce development model could be an idea to explore. Or consortium models. It also doesn't have to be something brand new. It could be something that's working right now that may not be as visible and that we can take as a best practice through this effort. This track could be a natural fit for those in clinical education leaders, health system partners. We had some questions through the registration process for the webinar where folks felt like they're in GME and they don't know where they fit. This track, for example, would be a perfect fit for anyone in the clinical setting. Preceptor could come up with a plan and hopefully work with AACOM to come up with a solution here. So move on to track 3, which is progression by mastery. It's sponsored by the National Board of Medical Examiners and BME. So we know that currently, mostly our medical student journey is largely time-bound. So the question here is, what if learners advanced when they showed readiness, rather than when the calendar moved? This is what this track is truly about, finding better ways to define, assess, and recognize mastery for learners and also for faculty who teach them. This track also asks what a mastery-based osteopathic pathway could look like. We're asking you to take perhaps one phase, one learner population, and one transition point and think through it. We know that competency-based education is not a new concept, but we're asking you to think about a piece of it that we could make work. So some ideas here: competency checkpoints for one phase or transition, real-time feedback systems or readiness dashboards, credentials that actually name a receiver that would accept it and would find value in it. For instance, if there's a credential, would residency programs or employer really value it? And maybe a pathway for faculty that helps move them closer to this progression by mastery model. Track 4 is about DOs as the human interface in AI-enabled care and is sponsored by Metrics. And the question here is, what if AI helped future physicians spend more time actually being present with their patients? So this is about preparing students to use AI critically and doing it well, so that technology is strengthening clinical judgment, is strengthening communication and trust with patients, instead of eroding them. The skill we want students to have is truly critical appraisal of AI output. So this track is about preparing learners. It's not asking you to write an AI governance policy or anything like that, although you may choose to do that. But perhaps you could consider an AI use curriculum or clinical simulation, perhaps a workflow that would reduce documentation burden so that students can spend more time with patients, a tool for critically reviewing AI-generated recommendations, or even a patient communication approach for AI-enabled care. Again, these are just ideas, and you probably have much better ones, but we just want to give you a sense of what's possible and make this more accessible. Track 5 is on OPP and OMM as a clinical service line and is sponsored by the Osteopathic Heritage Foundation. Students often disengage from OMM or OPP in clinical settings. We know that in the 3rd and 4th year, particularly if they lack the appropriate role models that are also using their knowledge, their skills, and their philosophy in patient care. The students may not have a small set of techniques that they feel genuinely confident performing. So the question we'd like you to think about here is, what would help students use OMM confidently in real clinical settings? And what would make its value visible? So this is about designing a practical clinical model that makes OMM easier for students to use, easier for preceptors to support, and also easier for organizations to sustain. So we want you to think practically. Perhaps you pick a high-yield condition, anchor it on a small basic skill set, and then address workflow or preceptor readiness, what the comfort level would be in a mixed setting with DOs and MDs, and then consider patient outcomes that you'd like to see. So the essential test perhaps for this track is sustainability. How do we make this work in the clinical setting, given time and other considerations? And how do we make this valuable for employers, for partners, and for medical students? So they're truly integrating osteopathic principles and practices and OMM in their clinical education. So after reviewing those tracks, we're going to talk now about how you can participate. So again, I want to clarify something that I already talked about, which is ways that you can take part. So you can bring a team. If you already have colleagues who you want to work with, that's wonderful. Teams are generally around 5 or 6 people. You could work within a single COM. A single COM could have multiple teams. You can work across COMs. You can work with clinical partners, but everyone still registers individually. As you register, you could actually ask to be matched. So if you don't have a team, but you want to work with a team, you can ask to be matched. And we will work with Be My App, our facilitator, to make sure that we're taking your responses, your interests, your background, perhaps even your time zone, to connect you with individuals. I will note that a team formation webinar is going to be scheduled on August 31st. And if you do want to be matched with others, you need to register by August 24th. That's a key deadline. So if you want Be My App and AACOM to work with you to match you to a team, please register by August 24th. You could also work on your own. So this is completely legitimate. You have full access to mentors, to all the support that teams would get through this experience. So again, 3 ways to participate: come with your own team, ask to be matched, or work on your own. And we do encourage you to collaborate as much as possible. So another key concern here that I want to flesh out is the time commitment. 6 weeks sounds like a large commitment, but it's not 6 weeks of meetings. This is where you work on your own schedule, whatever rhythm you and your team, if you work with a team, sets. So what we are saying is, or Be My App is actually recommending, is 1 to 2 hours a week for most of the event, rising to about 3 to 4 in the final week or 2 when you're pulling the submissions together. So maybe total of 10 to 15 hours for the whole 6 weeks. This depends on the complexity of your project, if you're working with a team, and various other factors. And as I mentioned, you could be done with it in 1 day. And critically, there's no live attendance required. Everything that's important, the webinars will be recorded and they will be available on demand. So you can work whenever you need. You can access the platform whenever you want, weekends, nights, although we don't want you to work weekends and nights, but you can access it whenever you want. And over here in blue, this is kind of what you would expect during your experience. You would have mentorship from people across the osteopathic medical education community, structured checkpoints so that you're not drifting and we're checking in on you, and technical support throughout. And of course, AACOM is here as well to support you. The GME team is here to support you throughout the process as well. So now let's talk about your submission. What do you actually hand in? So the top row is the story your submission really needs to tell, right? The problem, who it affects, your solution. We do want a short demo. I'll talk about that in a little bit. How your solution will start and what will change because of your solution. The project page is asking you these pieces that are in this white box. We'll ask for a project name and a 1-sentence summary. You'll choose your track and your current development stage. And over here, you'll see that we've highlighted that you can select in the development stage that you're at the concept level. That's perfectly fine. You do not need to have a final solution figured out. It could just be a concept that you flesh out over the 6-week period. We'll also ask what the problem is that you're solving, who experiences it, the proposed solution, and how it would work. We'll ask you to upload a demo video, no more than 3 minutes. We'll ask you for an initial implementation approach and up to 3 measures of success. We'll also ask you whether you want to be considered for an AACOM implementation award. So this is, thankfully, because of our wonderful sponsors, we're able to actually try to support innovative projects to implementation. So if you're interested in that, and we'll share more about this on August 31st during the kickoff webinar, please indicate that in your submission. So I'll talk a little bit about the demo video. So demo is another word perhaps that carries a technical baggage. So we want to define it and be clear about it. So a demonstration is simply you showing us how the thing or the solution would work. So slides would count. You might want to show us a process map. So that would count. You could walk us through a sample curriculum. That would work as well. Maybe it's a storyboard of a student's experience or a partnership model on one page and you want to go through the page and explain it to us. It could take many different forms. These are just examples of what you could consider. It does need to be 3 minutes maximum, and we're hoping that this constraints actually helps to focus it and make it more clear. Nothing needs to be built. Nothing needs to have been tested. What we want is for a reviewer, after finishing your video, to understand what problem you're solving, what your solution is, and how it would work if someone actually tried it. I know that Hannah's going to be posting an example submission that from our AACOM website from the All-In competition, which some of you might be familiar with at Educating Leaders in Vegas this year. Mark Spiker does a great job with a demo video. So please take a look at that as an example in case that's helpful to you. Another question that's come up through this registration for the webinar registrants is a little bit more clarity around how the projects are judged. So we will have a judging process after the hackathon concludes on October 13th. And we're looking at these 4 criteria. One thing to be clear about, these 4 criteria are the same for every track, for every challenge track. So the first one is, does your solution address the challenge and the people affected, so the stakeholder value? The second area is around your solution. Is it clear? Is it coherent? And is it meaningfully different? That doesn't mean that you have to have something brand new. It just means that, is it improving on something that's already happening? Or is it a status quo? 3, could it be realistically piloted? So this is about feasibility and implementation. And 4, what difference would it make in the real world? And how would we know? As you think about this, no technology or AI is required to count for innovative. So just because it's an AI tool doesn't mean that it gets more credit. Also, feasibility is judged relative to your stage. So we talked about, as you submit your project page, you can select concept level. So if you're at a concept level, the judging will take that into account. It will not count against you if you don't have a finished product, as I mentioned earlier. It also doesn't have to be national in scale. So it can be a local or regional solution. Existing projects are also eligible for full credit. So if there's a project that you're working on that meets these challenges and you propose a meaningful improvement or expansion, that would work as well. There are also no additional track points. So choosing a certain track or challenge track does not earn extra points. So just want to be clear about that. Now let's talk a little bit about prizes. So to incentivize the community, and we know this is a very competitive community as well, we do have a prize pool of $10,000, and it'll be shared among the top solutions as chosen by our judges. There'll be more details about this, again, the kickoff webinar on August 31st. I'm not going to share more details there, but we want to just thank our sponsors who are not only supporting this whole effort, but also making additional implementation funds possible. This is really to help promising solutions actually get piloted. So when you fill out the project page, as I mentioned earlier, there is a question that asks you whether you want to be considered for that. Select that if you feel like you want to be considered for that, and there'll be additional content that we'll need from you at that stage. Again, more details on this is when we kick off on August 31st. We do want to encourage student engagement in this effort. So we believe that students have a lot to contribute to these challenge tracks, and we would love to have them engaged. If students complete and submit a project, they do receive a certificate of completion. So if you're able to share this with your students so we can see engagement from our students, we'd love to see that. Again, we want to thank our founding sponsors, our presenting sponsor, American Academy of Family Physicians, AFP, our track sponsors, the American Osteopathic Association, AOA, the National Board of Medical Examiners, and BME, the Osteopathic Heritage Foundation, and Metrics. All of these sponsors are founding sponsors of the hackathon. Very excited to work with everyone. You will hear from all of our sponsors during the kickoff on August 31st. So please register so you can have access to that webinar. I just mentioned the webinar. Again, what will be covered there, they'll do a walkthrough of the platform step by step. So you're very clear about what you can expect. You'll be able to talk through the tracks. We'll have a live Q&A with Be My App, the facilitator for this hackathon. And if you register, you'll get a link where you can join the webinar live. So please register so that you can access this truly important kickoff webinar. So what do you need to do today? I think I have said this several times. So if you haven't registered, which by the way, many of the people who signed up for this webinar, for this information session already have registered. So, but if you haven't, please register. It takes minutes. You can scan the QR code. I'm sure Hannah's dropping the link in the chat as well. Tell us about your team status, and if you need help matching, or if you want to go on it alone, or if you already have a team. Please whitelist Be My App at acom.org. This is where you'll get a lot of key information if you're wishing to participate in this effort. So please whitelist them so you're getting all the communication. And do not wait for the perfect idea. If you're passionate about clinical education and making a change, want to contribute, as Dr. Cain mentioned, want to be part of the solution, please register and engage with us. I do want to note that right now, because the platform isn't live until we kick off on September 1st, you can't select a track. But think about the tracks. You have the track language on our website. Think about what you're passionate about and what you can contribute to as we wait for August 31st. And again, I want to reiterate the August 24th deadline. If you do want to be matched, you want Be My App and AACOM to work with you to match you to a team, please do register by August 24th.